I'm Dr. Ahmed Kazmi, and I am a UK-trained consultant dermatologist and GP, currently based in Australia. I am a general dermatologist, so I deal with all pediatric and adult dermatoses, but my primary focus are hair and scalp disorders and medical education, but I also have a special interest in psychodermatology, skin of color dermatology, small molecules, and transgender medicine. I think normalizing their experience is very important. Mental health and mental well-being problems are generally still stigmatizing in most communities. So you as a clinician being able to tell them that what they are experiencing is normal and common, I think it is in itself very cathartic for patients and a good starting point. The first step is rapport. If you have created an environment which is open and respectful and caring, the patient is more likely to share how they actually feel. The next step would be open questions. So I'll ask, how is this affecting you? How does this make you feel? The next step would be more closed or specific questions. How is this impacting your work? How is this impacting your social life? How is this impacting your sex life? The next step is to explore what they have already tried and what support they have. So, have you spoken to anyone? How do you manage this at the moment? The next step is to formally quantify things. And I do this usually using scales, such as the DLQI or HADS. Then once I have all the facts, I can make an assessment on which psychiatric comorbidities exist and how severe they are, and therefore what treatment is needed. The most important thing for me is for them to be able to appreciate that the two things are inextricably linked, and that their psychological well-being is going to affect their skin, and that their skin disease is going to affect their psychological well-being. And I think if they understand this relationship between the two, they're much more likely to wish to engage in treatment. Otherwise, there is mistrust or confusion why a dermatologist who is seen as somebody who should just be treating skin is so interested in their mental well-being. So I spend a lot of time exploring that relationship.